Dr. Andrea Link is a fellow of American Leadership Forum and a board-certified pediatrician. She received her MD from Stanford University of Medicine. She developed Healthy and Whole, an initiative, award-winning program which provides women exiting prostitution and human trafficking with comprehensive trauma-informed health and wellness programs. We're just standing up here talking about it. It's such a beautiful movement and work. She also serves on the board of directors of New Hope Housing and Yes Rep. Dr. Link's talk today will focus on fostering community well-being and update us on health equity efforts here in the Houston area. Please welcome her to the stage.
Thank you. Thank you so much for that introduction, and thank you truly for the honor of coming to speak about this really important topic today. I think I've been in other rooms the whole morning, and I think what this talk is really about is broadening the conversation a little bit from more individual wellness to what we can do to enhance our community wellness, because I firmly believe we all have a role. I'm going to tell you a little bit, give you a little bit of a dashboard of how our region is doing when it comes to health and wellness and health equity. And then we're going to talk about some really innovative solutions that are out there to make our region more healthy. And then I also want to talk just a little bit about some exciting trends that I see in public health and in human services that I think are also really good news. So these two quotations are really kind of my grounding principles in the work that I do. And it's definitely the grounding principles of this talk. You may have heard, probably, both of these quotations. And the first is from an Aboriginal activist, Lila Watson. And she wrote, "If you have come here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together." I'm just truly of the belief that if anybody isn't free, I'm not free either. And then MLK, "Of all the forms of inequality, injustice in health is the most shocking and inhuman." So it's hard to talk about health equity without getting political. I'm going to try, and I'm just going to present you the facts. So here's some facts, indisputable facts. We are the nation's 4th largest city, and we have the largest medical complex in the world. But entire neighborhoods have limited access to health care and healthy food, and that's made worse by inadequate crumbling infrastructure and environmental hazards. In Harris County, 24% describe their health as poor or fair, as compared to the national average of 17%. Texas leads the country with the highest percentage of uninsured individuals, with almost 1 in 5 not having any health coverage. So let's look at what makes a healthy community. You will notice there are some things that are not on this wheel. So we're really not looking right now at individual things like genetics, your chronic disease, the trauma you may have sustained. We're really looking more at things on a communal level. And the great news here is that on this wheel, these are all mutable things. These are all things that can be changed. But I want to personalize it a little and talk not so much about broad strokes of transportation and access to care, but rather on a personal level. And I'm going to tell you the story of 2 people on a given Tuesday morning. One of them is me, and one of them is the very first client that I had when I left. I had to change in my interests from pediatrics to women who were incarcerated. And I was more interested in the psychosocial issues of incarcerated women. And I left my pediatric practice and I worked for 6 years and then another 10 years after I developed the program with women exiting the criminal justice system. So I spent a lot of time at Harris County Jail. And the person I'm going to tell you about, I'm going to call her Miss Timmons. She was my very first client. And I messed everything up on her. Literally, I would send her somewhere and she'd come back the next morning. I sent her at the wrong time with the wrong paperwork. I was just a rank beginner. But she stuck with me. And now, almost 15 years later, we are still genuinely friends. And she's doing beautifully. But let me tell you, she fought against every one of these things to be as healthy as she is now. So let's start in the morning. So I wake up in my home. It's comfortable. It's safe. Ms. Timmons wakes up in her home. It's actually a nice apartment. I have been there. But the only reason it's a nice apartment is that she lives in a subsidized apartment. She is a Black transgender woman who is HIV positive. And when she got out of jail, when I picked her up so many years ago now from jail, we found her a community agency that would support her because she was disabled, and she got drug treatment and has been clean and sober for 15 years. So her apartment's not bad, okay? But again, if she was only living on her disability check, no, that's not the case. As I go out to my car, I'm gonna wanna go exercise. I'm not worried. I live in Bel Air. I'm gonna walk out to my car. I'm not thinking that I need to look out for danger or anything like that. When Ms. Timmons leaves her apartment in the 5th Ward, she's immediately on alert. She has to be aware of her surroundings, and particularly as a Black transgender woman, she really has to watch for her surroundings. That cortisol surge, she has it, I don't, because I'm just walking out to my car. I'm breathing in, not bad air. There's certainly issues in Houston, but there's nothing in particular that's bad in Bel Air. But in the 5th Ward, she lives fairly close to the United Pacific Railroad track. You may have heard about it on the news. They, for many years, used creosote to preserve wood at this particular location, and it is sunk into the ground. And not only do we now know that creosote is a human carcinogen, but there's a cancer cluster there as well. And they are now paying people to move out of that neighborhood. So there's an environmental impact that she has to live with that I don't. The next one, I take my car. I have my jazzercise that I love doing 3 minutes down the road. If Ms. Timmons wants to exercise, she has to get on the bus. Now, there are alternatives. The Y has some wonderful sliding scale exercise programs, but for her, that's a 45-minute bus ride. And let me be honest, if I had a 45-minute bus ride, you would very rarely see me going to exercise. That's just the truth. Parks and recreation. I have lots of parks. I have a park across the street. There are more parks coming to the 5th Ward. That area is getting a lot of attention, but historically, that has not been an area of much quality green space. Quality affordable food. 5th Ward is a USDA certified food desert. So what is, we hear food desert all the time. What does that really mean? It means that 30% of that neighborhood is not within 1 mile of a grocery store. What they are close to are a lot of convenience stores that have limited, if no, fresh fruits and vegetables, okay? And if you think about what it's like to carry in groceries, it's really hard to carry a lot of groceries in long bus rides where you have to change multiple times. And then access to care. I'm gonna talk about this a little bit more in just a moment, but I have good health insurance from my work. I don't really worry about it. I know it's there. I've had things happen and it's been covered really nicely. Now, Ms. Timmons is lucky. She has Medicaid, but that's only because she's disabled. And I'm gonna talk about the importance of that fact in just a moment. And then as far as educational opportunity, my kids were zoned to Bel Air High School, terrific school. 5th Ward is mostly served by Phyllis Wheatley. That's really turned around. That school is very much turned around, but historically that has not always been the case. A Yes Prep school, as you mentioned, I'm on the Yes Prep board. I'm so proud of what we're doing. There's a Yes Prep now in 5th Ward that gives parents some choice. And then social justice. There's just no question that Ms. Timmons' body is policed differently than my body. I just don't think anybody can argue that. And that educational opportunity and economic opportunity go hand in hand. So when we look at this, I picked the Heights because it's right next to 5th Ward. It turns out that unfortunately, to a certain degree, your destiny is your zip code. Because if you live in 77007, that's the Heights, that's 3 miles away from Kashmere Gardens, that's 5th Ward, your life expectancy is 16 years shorter. So that whole wheel conspires to make the individuals in lower income areas like Kashmir Gardens dramatically different. I'll just tell you one more fact. You may know the Kinder Institute survey. Every time I read this, I'm taken aback. More than 40% of area residents just here in Houston said that they would be unable to come up with $400 in an emergency, okay? And it broke down very much by race and ethnicity. And to be perfectly honest, our safety net is not much of a safety net, at least not in Texas. Again, you may know all of this stuff, but I think it still bears repeating. There is no such thing as welfare anymore. The only cash payment that you can get is something called TANF, Temporary Assistance for Needy Families, and it's only for families with children. But in order to qualify for it, you have to make less than $226 a month as a family of 4. And the largest cash benefit you can get is $375 a month. SNAP is a new form of food stamps, okay? It is more generous, but really it's only for those who have children in the house under 18. Well, what about for adults? Don't they deserve good food as well? Most adults age 18 to 52 with no children in their home can only get SNAP for 3 months in a 3-year period. And to qualify for that, you must have less than $2,000 in the bank. You have no safety net there, right? If you have a documented disability, but you have not worked long enough to qualify for SSDI, then your SSI check is $943 a month. And if you are working minimum wage, it's $1,200 a month. That's a very small amount of money to try to make all your bills paid and to eat healthy. Our medical safety net is not much of one either. We do have a wonderful, Harris Health is a wonderful system, but it isn't free. I think a lot of people think it's free. It's not. It is not free. Insurance is still really important. In states like Texas, without Medicaid expansion, you cannot qualify for Medicaid just by income. It's only by a documented disability. So because we were one of the states, I think 10 states, that don't have Medicaid expansion, there are 1.4 million people who are uninsured who would be insured if we expanded Medicaid. And we know in states where they expand Medicaid, things get better. Not only do you have better health outcomes, but there are all of these secondary benefits as well. The family is no longer paying out of pocket for every prescription, every doctor's visit. That means more money stays in the community. There's more money left over, so child support payments go up because there's money again in the community. Housing security goes up. They buy healthier food because they're not spending quite so much money on paying for their health care. There's more money for college. More kids are going to college. There's actually even decreased criminal behavior because there's less desperation. Then there's also the coverage gap. You may have heard about that. The coverage gap is for people who are, people who are too poor to qualify for the ACA, but ineligible for Medicaid because they haven't enacted Medicaid expansion. And right now, 766,000 people fill in that gap. There is the Harris Gold Card, and that's a sliding scale, but a lot of people think that's insurance. It's not. It is a financial assistance program that is a sliding scale. So it's a little overwhelming, right? Like, how do we even begin to address this? Well, there are some amazing community organizations doing work in this area, and I want to highlight them. And I want to first preface it by saying these trends that I was talking about that I'm really excited about, there's a couple of things that are happening in public health and in human service agencies. And one is that historically, public health has sometimes blamed the community. Say, well, you're obese because you're just not eating right, and if we just teach you how to eat right, you'll be better. Well, again, you have to think about all the structural things that we just talked about, structural racism, structural colonialism, that impinge on anybody's effort to be healthy. What we really need to be doing is looking at the underlying problems that got us to this place and maybe blaming the community a little bit less. The second thing is to look at communities through an asset-based lens. Instead of coming in and saying, well, here are all the long list of problems that you've got, let's bring the resources from other parts of town that are more well off. And let's not just ask you, what do you need? But what are your strengths? What are the strengths that we can capitalize on so that we can work together and solve these problems collaboratively? And then lastly, the old model, the really old kind of patriarchal model is, well, I know better. I know what's here. I'm going to be here to help you because you know less than I do. Well, to me, the second generation is, you know what? Let's work collaboratively. Let me companion with you. Let me learn from you as much or more than you're learning from me. And then where we're really going is let's find and elevate the voices of the communities, the people in the communities, to lead themselves. So those three, and I'm going to give you an example of a couple of agencies that I see doing a lot of that good work. So I'm going to talk about New Hope Housing. I'm very proud to be on their board. But they are, since 1993, have offered a really innovative solution to housing affordability. This model, this complex that you see there is typical. It's beautiful. It's absolutely beautiful. It's LEED certified. There's grills out in the courtyard. And the idea is that, and fountains and beautiful green spaces. The idea is that everybody should be able to live with dignity. And they get around so many of the problems that we have with housing because they allow a lot of felonies that other landlords don't allow. And they have on-site services so that if you want, like for example, one of the really exciting things is we're going to be opening our third Bezos Academy in buildings at Reed. The first one was Reed. And the second one will be, I think it's Savoy, and there's a third one coming as well. So Jeff Bezos funds these, there's a partnership, and these kids get high quality preschool right in their buildings, so they don't even have to leave the building. Another one, that's a big agency. Now let's get to a small one. It's a really beautiful farm called Small Places, or Finca Tres Robles. And this is in the 3rd Ward, and what they do is they look for unused or underutilized land and treat the soil and build a farm and allow the community to come in and tend the farm. They are working towards expanding to having classes and nutrition and cooking lessons. And the whole idea is to come into a community and build on the resources that are there in a very collaborative way. Another one, and this is a big one, is Interfaith Ministries for Greater Houston. Meals on Wheels is not one of those sexy organizations and sexy programs, but it is so effective. So they provide meals for over 5,500 homebound seniors and disabled adults, but they do more than just provide healthy food. On their birthday, they will give them a birthday card, and what they found is most of them, that is the only birthday card they're going to get. So they make them a little package. The volunteers come in and so that they get something special on their birthday. They get to know their driver. There's that human companionship component to it as well. And then a lot of these elderly and disabled folks have a pet that they just adore and want to take care of as well. So they have an Animeals program where there's delivery of pet food so that they can keep their treasured companions as well. And then I have to give a little plug. This is the organization that I'm the executive director of now. And the way I've talked about community organizations, this is how we strive to work. This is part of a national organization. We're one of 11 chapters. We're the largest, because in Texas, go big or go home. And we give graduate student fellows as well as a small undergrad program, and we have scholars. These are pediatric residents who are from Texas Children's. And we give them an opportunity to do a mentored year-long community service project that addresses an unmet health need in a vulnerable community. But what I really love about this is, first of all, we want to be invited into the community. We no longer follow the old model of a fellow comes up with an idea and thinks, well, I've Googled this, I think this is what the 3rd Ward needs. No, we will go out and talk with agencies, and myself and the program director, we hear from the agencies, and we want to hear from the community. Well, what are your needs? What could we help you with? So then we list it on our website. For applicants, we get way more applicants than we can support. And then we find that wonderful, in that Venn diagram, the two circles that come together, the graduate students' passion, interest, and skill area, where it overlaps with community need. And that's when we see the magic happen. We work with 20 consortium schools. So these are medical school, pharmacy, nursing, social work, public health. And we immerse these young people who've got innovative ideas, but they just don't know how to make it happen. And we mentor them and help them and support them financially so that their ideas that start out as a co-creation with them and the community partner to make really significant lasting change. We are not a one and done kind of organization. We have legacy projects. 80% of our projects continue on the next year. Some end because you don't need it. There's not as much issue with vaccine hesitancy. We had a lot of vaccine hesitancy programs recently. But we have partnerships with places like Small Places and New Hope Housing. I would be very remiss not to discuss the wonderful program that the Doctors Chawla runs. They are a nonprofit dedicated to fostering peace and wellness in individuals by introducing and advocating for a holistic lifestyle that focuses on plant-based nutrition, yoga, and meditation. They're doing some absolutely wonderful work out in the community, and they're teaching pastors, leaders, and residents of the Third Ward so much of the material that you have been getting today. And as we talk about collaborative movements, this is a really exciting one. The School of Public Health has a health equity collective that was started a few years ago. And what they really saw was that none of these intractable public health problems are going to be solved by any group of individuals by themselves. So what they did is they pulled together 200 organizations, 50 coalitions, and they have different focus areas on food deserts and in food security, on transportation, all of these things that factor into health and are really trying to get people to talk with each other so that somebody who's working in health is talking to somebody who is working at the food bank. And then in terms of, what can we do? Right, as individuals? Well, I think there's so much that we can do. I think the first thing is giving your time, talent, and treasure. That's a good place to start. Volunteer Houston is a fantastic, many of you have probably looked at it. It's a really fun and well done website that's run by Interfaith Ministries. And if you have a passion, if you have something that you're good at, if you're a yoga teacher, you can look for exactly what you want to give to the community. When I was at Angela House doing the Healthy and Whole program, this is how I found my yoga teachers, is I put a listing on there. I said, I need yoga teachers on Tuesday afternoons. I had 4 people apply. It was really wonderful. And now they still have a robust yoga program there. But you can do it by interest area. You can do it by something you want to do remotely. You can do it by your own particular skill set, and it will connect you with community organizations that are in need of the help. Another one is give your treasure. Give to your favorite nonprofit. I will also steer you towards, in particular, the Greater Houston Community Foundation has a wonderful list of Black-led nonprofits. And you can look there for some organizations that are being led effectively by members of our African American community and have the seal of approval of the Greater Houston Community Foundation, which is a well-known foundation here in town. And then the last thing is to inform yourself, right? I'm on the mailing list for the Kinder Institute. I think that they send out marvelous, nonpartisan information about trends that we're being seen in our region. And I think it comes from a really scholarly but very grounded place. And then ask the important questions. You know, when we see inequality and inequity, to ask why. And I think the more people we have asking why, the faster we will get to solving some of these really difficult problems. We have time for questions.
We do. Thank you so much. Thank you, Dr. Link. If you do have questions, we do have a couple minutes, so please feel free to raise your hand and Dr. Link can answer those for you. If we don't have any or we run over, you can definitely meet her at the speaker table.
Working with you. But how do you approach that silo mentality when it does come into, you know, terms of health and getting all these different areas that have solutions but are so far apart from each other when it comes to affecting change? And to add to that, what are your thoughts on the Uplift program that was modeled in Harris County?
Yeah. So I love that question because I think there's anybody who's worked.
Yeah. So I love that question because I think there's anybody who's worked in the social services field understands the problem with silos. That people aren't communicating, right? We're all working and rowing in the same direction, but we're not because nobody knows what everybody else is doing. That's why I mentioned the Health Equity Collective because it's bringing cross-sector collaboration. I can tell you that something that I really stress with our fellows, I tell them, we're about to do our orientation actually right here 2 weeks from today. And I'm telling them that I want them to, right now, connect on LinkedIn with people from other sectors. Go to conferences that are different than the one, not just do your standard public health, go to a nursing conference, see what they're working on. That's also part of the philosophy of the fellowship is to get dentistry students and pharmacy students all understanding that their interests are the same. They may be attacking the problem from a slightly different way. And then the Uplift, I mean, okay, I promised I wouldn't get political. You know, I mean, look, if you look at TANF, that's such a tiny amount of money. It's like, if it wasn't so sad, it'd be comical. I mean, if you're making $275 a month as a family of 4, and you're gonna get another $350. And honestly, one of the, I almost included this on the slide, but I give it to the fellows on our first session together. I give them a multiple choice question. I said, which of these things must you do to receive TANF? And it's like, not quit a job, make sure your kids' vaccines are up to date, log this many hours. I mean, it's like 8 things that you have to do. And of course the answer is, it's all of the above, right? So the bar is set so high. So if, you know, I think it's a little bit like housing first, right? Sometimes if we can just take care of the most pressing problem that a family or a person has, the rest is gonna fall in place. So housing first, for anybody who may not be familiar with it, is counterintuitive. It says, we're not gonna wait for you unhoused person to clean up your drug addiction, get a job, get clothes, get a furnished apartment. We're gonna house you first. And it's remarkable that when you house people first, a lot of the things start to fall in place. Suddenly, they're able to be compliant with their medications. They are now able to shower every day so they can go look for a job. So reducing barriers to assistance, I have a hard time thinking that that isn't the right thing to do. Because the studies show it. Housing first is absolutely, housing first with some services, that's even better, right? But just getting people into an apartment, and it seems counterintuitive, it's not the way our culture works, right? You should earn your way into that apartment, right? Except let me tell you, the people who are unhoused have come from a history of trauma and difficulty that would bring most of us to our knees.
Oh,
Yeah.
sorry.
I hope I didn't miss this, but what kind of ideas have been come up with to help the food desert situation?
Yes, I'm so glad you asked that. Yeah, there's a lot of stuff happening. So Baker Ripley actually has a program now bringing food in mobile trucks to those areas. Another agency doing amazing work is called Brighter Bites. This was started, it's now in about 9 different cities, and where they looked at and said, well, where are we seeing kids for sure? School. So Brighter Bites is in, I don't know how many hundreds of schools in the Houston area, plus New York and Chicago and a bunch of other places as well. And when kids leave to go home on the weekend, they leave with a backpack full of fresh fruits and vegetables and recipe cards to show how to do those things. And the results on Brighter Bites are unbelievable. They're unbelievable. Walmart now supports them. H-E-B has always supported them. So there are a lot of innovative ways to get this healthy produce, because the truth is you may or may not get a for-profit entity in those food deserts, but you can. There are innovative ways to still bring that food to the community. Finca Tres Robles is another perfect thing. Grow the food right there.
Thank you, Dr. Link. Please, a round of applause for all that great information.